I'm Anita W, and I'm the Medical Director of Spinal Cord Injury Medicine at Northwestern Medicine Marianjoy Rehabilitation Hospital. I cared for a patient at Marianjoy who had a new spinal cord injury secondary to intrathecal chemotherapy causing myelopathy. And because she had a diagnosis already of cancer as well as a recent COVID-19 infection, that made her rehab a more complex stay. Due to her treatment of her leukemia, she had been getting intrathecal chemotherapy, and that unfortunately caused the myelopathy and the resulting paraplegia. As a result, she had changes in her bladder and bowel, having neurogenic bladder, requiring intermittent cathing, had neurogenic bowel, requiring a bowel program, but also due to her complex history with the cancer and the COVID-19, she also had heart arrhythmias, so she had heart rates up to 130s, and she also had a lot of fatigue related to her cancer. So this was a unique case where we had a patient who required multidisciplinary rehab interventions, but also consulting and utilizing our oncology team as an outpatient and our inpatient cardiology team to manage her heart rate and her fatigue. Our patient was also Spanish speaking, so given that English was not her first language, we made sure that there was an interpreter present. Because of her history of the COVID-19 and the precautions, we were able to accommodate this with a telehealth interpreter. So having an interdisciplinary team with spinal cord injury dedicated staff and therapists to take over her primary rehab diagnosis, but then also having the medical team understanding her other comorbidities really allowed us to tackle from every aspect her rehab and have the best outcome. What is unique about Marianjoy is that we do take an all-encompassing approach. We do want to care for not only a patient physically, but also, with their psychological support with a new diagnosis of a spinal cord injury, and also, taking into consideration now living in a post-COVID world, how do we allow families to come in and get that training too with our patients? Because having a spinal cord injury is very life-changing, and it involves not only the patient, but also their loved ones. And I think that really does help families and patients get prepared going home. Especially in this case, she had 3 rehab diagnoses that we were trying to treat all at once. So the patient was able to discharge directly to home. So it was very good that she did not need more rehab in another facility and was able to be at home with her family on discharge. Her family was able to come in and practice all the bladder and bowel management, all the medications that she was going to be on, understanding her transfers and her wheelchair mobility needs. So in the end, she was able to go home more at an independent level than when she came in. I think it's important as rehab physicians that when we have a spinal cord injury patient, who also has other comorbidities, that we advocate and make sure that they do get to a spinal cord rehab unit where you have that interdisciplinary team that is experienced in treating and caring for someone with a new spinal cord injury.